Good evening. Let me just do that. There we go. Okay. Good evening, everyone. Evening. Thanks for joining, everyone. Let's see. Hi, Sarah, Monica, Leanne Presley, Tani, Paulina. Thanks for joining. So tonight we're doing a Q&A, and you would have seen that on our Insta. I would have posted, like, you can leave your questions. You have any questions for Dr. Olarogun. So we're talking to Dr. Femi Olarogun from HART Fertility Clinic. Hi there, is it Camobi? Thanks for joining. Kist, Poslu, thank you. So I'm just going to send Dr. Olarogun an invite. Before I do that, so I don't know if you guys have seen, anyone that's in the Pretoria area, we are having an event, a VIP fertility luncheon. I've only got a few tickets left. If you guys want to join us, it's happening on the 3rd of September at the Menon Boutique Hotel. Please let me know. As I said, I've only got a few tickets left, and there's only so much we can take at the venue. So please just let me know. Send me a message after we do the talk. And yeah, so I'm just going to invite Dr. Olarogun. Hearts. Here we go. So you guys sent me questions, I would have it. And we had so many questions. Dr. Olarogun. Here we go. I hope I'm on the right one now. Okay, I think happening. Okay, just waiting for Dr. Olarogun to accept my invite. He is there, and I think it's starting a bit. There we go. Let's see. Okay, you're unable to join, Dr. Olarogun. Maybe try another device like you had the last time, and then let me know when you're ready, or otherwise go on your own. I think he's unable to join with the device he's got. Okay, let me just try a live Dr. Olarogun. If this is not working, then it's your device that you're using. Maybe switch your device. Okay, there we go. Working. Hey, Dr. Olarogun.
Hey, how's it?
Fine, and yourself?
Good, thank you. Sorry, I'm not sort of catching up on the iPad, so I have to use the phone. I suppose that's okay.
Yes, that's perfect. Absolutely perfect. It's actually better. So thank you for joining.
No problem at all. If you give me a couple of seconds, I'm just going to try and make sure that well, you can hear me. I don't have to. You can hear me well?
I can hear you perfectly. Okay. Absolutely perfect.
That's perfect. Then. That's good.
Okay. So, as I said, we're talking to Dr. Femi Olarogun, and we did a post this week, and we said that if anyone has questions, please send it through to us. So we had quite a lot of questions, and we've had to cut off here and there, try and get as many of the questions in, work it in as much as we could. But again, we only have so much time for this, and we try to take as much as possible. So I'm going to get right into it. First of all, thanks, Dr. Olarogun, for joining us, taking the time to be here with us and do this talk with us. If you could maybe just introduce yourself and where you're from.
Sure. Well, I've been on this on the first time I'm doing this with you, right? So your audience probably knows I work in Cape Town at the HART Fertility Clinic as one of the specialists there. I am also a general gynecologist, so I do a bit of gynae work as well, and I also teach at the teaching hospital at which is key. So that's kind of what I do.
Perfect. And then, okay, so the first question we're going to get right into it says, I had an ectopic pregnancy last year and lost my right fallopian tube. Since then, I've had 2 biochemical pregnancies. Could the ectopic episode be causing this? I have a 3-year-old daughter and fell pregnant very easily the first time round. Should I be going for tests after having 2 biochemical pregnancies? My gynae thinks I should just continue as normal.
So there are two parts to that question. The
Yeah,
first part is whether or not she thinks that the ectopic pregnancy she had is contributing to the biochemical pregnancies, and that's not true because the biochemical pregnancy would indicate that there is implantation. So, in other words, most of the time, what happens with this is implantation at the level of the uterus. So it means that the fallopian tube, the other fallopian tube, is working. I'm assuming this wasn't by IVF, was it? This was just normal pregnancies. That she wasn't like there wasn't IVF. Yeah. So that means
yeah,
the other fallopian tube is working, and
yeah,
there's implantation happening, but it's not continuing to grow. Now, there's a number of reasons why that can happen. The commonest will be if the embryos are not chromosomally competent. So
yeah,
the chromosomal competence of the embryos might be a problem. Unfortunately, a lot of embryos that women produce or couples produce are incompetent in terms of having chromosomal abnormalities, and that's probably the main reason why that happens. Less likely is the fact that there might be a problem with the uterus itself, but that's unlikely. So, I mean, the one thing I'll probably do here, I don't think I would do too many in the way of extra investigations, but perhaps maybe just make sure she gets a proper ultrasound scan. A hysteroscopy doesn't make that much of a difference, but if the ultrasound scan suggests that there's something going on, then a hysteroscopy might be useful, and then just give it another try. And if that happens again, then there might be a need to then start investigating for other things that might be the cause of recurrent pregnancy losses.
Okay. And then question number 2 is, I had one of my fallopian tubes removed, and I was told it was completely blocked or damaged. We tried to conceive but didn't succeed. We then did IVF. We did 2 transfers and both were not successful. What could be the reason? I'm exhausted with the whole process. I'm currently 32 years old and I now have 2 embryos left, quality AB and BB.
Yeah. So, I mean, what you described is not unusual, unfortunately. IVF is never 100%. It's probably still her best chance of conceiving. So she's on the right track in terms of trying to conceive.